Hello and welcome. We will be discussing anemia in this video. Before starting with the anemia, we should have some basic conceptual knowledge about different types of red blood cells or other blood cells and how they are produced, where they are produced. So all that we are going to discuss in this lecture. So in this lecture, we'll be highlighting a little about the bone marrow, the different sites of hematopoiesis, hematopoietic stem cells, hematopoiesis in details we'll be discussing about. We'll be discussing about RBC in very brief, and then how they are formed inside the bone marrow and all. And then we'll be discussing about the reticulocytes, what is reticulocytic index, what is reticulocytic count, how reticulocytes are important for us. So everything we'll be discussing here. So first of all, if I talk about the bone marrow, so let's just talk about the striking features of the bone marrow. So in bone marrow, if I talk about the content of the bone marrow, so there are two important ratios for us to talk about. One is fat is to hematopoietic ratio. So bone marrow contains fat as well as hematopoietic contents, and the ratio is equal, that is 1:1. And the second thing is the myeloid to erythroid ratio. And this ratio is 3:15 for the myeloid and 1 for the erythroid component. So we must say that myeloid component is at least 3 times more than the erythroid component. So when we talk about the bone marrow, so we can see here that this is the bone marrow, and in this bone marrow we have stem cells with us, and these stem cells are going to produce different types of cells like red blood cells, whether they are producing the platelets or whether they are producing the leukocytes. So we'll be discussing everything about this in details. First of all, I must tell you the different sites of hematopoiesis we should know about. The sites of hematopoiesis. So we can say that bone marrow is not the sole thing where blood cells are produced. So from the starting of birth, from the intrauterine life, we have a lot of organs in which this is produced. So if we talk about the different sites of hematopoiesis, first is third week of intrauterine life, we have yolk sac. Third month of intrauterine life, we have liver to produce the hematopoietic cells. Fourth month of intrauterine is that from where bone marrow is activated, and that takes the responsibility of producing the blood cells. By the birth, these cells, this bone marrow is going to produce all the hematopoietic cells, and the bone marrow of whole skeleton is taking part in it. And when the person reaches the pubic age, that is the puberty, the function of producing blood is restricted to a small part of the bone marrow, that is red marrow, and is generally seen in the flat bones. So at pubic age, the different bones which are taking part in formation of bone marrow are, in formation of blood cells are vertebrae, ribs, sternum, skull, pelvis, and two long bones, I must say, the humerus and femur. This humerus and femur, the proximal part, not the whole bone, just the epiphyseal part or the proximal part, takes part in formation of blood cells. So this is all how the different types of cells are formed and at what age of life. In the third week of intrauterine life, we have yolk sac. In the third month, we have liver. Fourth month of intrauterine, bone marrow. By birth, the whole skeleton, bone marrow of whole skeleton. And by puberty, we have only flat cells, flat bones, the red marrow of those bones, which are vertebrae, ribs, sternum, skull, pelvis, and few long bones like humerus and femur, which will be forming the blood cells by the active end, that is the epiphyseal end. So now coming to the next part, the hematopoietic system. So if we talk about the hematopoietic system, it has special hematopoietic stem cells which will be positive to CD34 positive receptors. So these are CD34 positive cells, and they are giving rise to different lineage of the blood cells. So that we'll be discussing. In this figure, as we can see, we have stem cells. These are the pluripotent hematopoietic cells. Now these hematopoietic cells are going to form either colony forming unit spleen or lymphoid stem cells. Now these colony-forming spleen cells will be forming either CFU blast, CFU GM, here G for granulocytes and monocytes, M stands for monocytes, and CFU M, it is for the megakaryocytes. Now these CFU-B will be forming the erythrocytes, that is CFU forming unit erythrocytes, which will be ultimately forming the red blood cells. This CFU-GM will be forming granulocytes, that is our NBE, neutrophils, basophils and eosinophils, and the GM will be forming, the M will be forming the monocytes, which later will be forming the macrocytes. CFUM, these are the megakaryocytes, which will be ultimately forming the platelets. Now the LSC lymphoid system will be forming the T lymphocytes and B lymphocytes. These are the defense cells which are responsible for maintaining the humoral immune system. Now again, if we want to talk in general terms about the different lineage of this, so we can again say the hematopoietic cells, stem cells, form basically three types. One is trilineage, myeloid cells, which will be giving rise to normoblast, that is the RBCs, myeloblast, these are again our NBE, that is neutrophils, basophils and eosinophils, the granulocytes basically, and the megakaryocytes, which will be forming the platelets. Again, another group of the cells are monoblast, which will be giving rise to the monocytes, and the third is lymphoblasts, which will be forming the lymphocytes. So we can remember either this or this. The reference for this is Guyton and Hall. Now coming to the next topic, that will be our RBC. So now coming to the RBC, if we talk about the RBCs itself, so RBCs are red blood cells, also known as erythrocytes, and these red blood cells are biconcave in shape and something like this. They are biconcave in shape. Their inner diameter is smaller than the outer diameter. So these biconcave in shape, and the diameter of these are again 7 to 8 micrometer, which is important for the exam point of view. Now they have certain membrane proteins, and these proteins are responsible for maintaining the membrane of these RBCs. The proteins are spectrin and ankyrin. So the spectrin proteins or the ankyrin proteins which are present on the membrane, they both help in maintenance of the biconcave shape of the RBCs, and this biconcave shape further helps these RBCs to cross small blood vessels. So how? They will be providing a property of deformability. This deformability helps these RBCs to cross small blood vessels. So if their ankyrin or ankyrin is absent, so there is a condition which is known as hereditary spherocytosis. So the biconcavity shape of the RBCs is lost and they will be becoming a sphere. So it is known as hereditary spherocytosis. While if there is problem with the spectrin, the absence of spectrin, it may lead to hereditary elliptocytosis. So the cells will become elliptical if there is a problem in the spectrin or the spectrin is not there. There are two terminologies. One is anisocytosis, which means the RBCs are of unequal size. There is a problem in the size. And there is another terminology is poikilocytosis, which says that the RBCs are of different shape. Again, concluding with this, we have 7 to 8 micrometer diameter. We have two proteins, that is spectrin and ankyrin. This spectrin and ankyrin is responsible for maintenance of biconcave shape of the RBC, which provides the deformability to help to close the small blood vessels. If ankyrin is absent, there will be a condition known as hereditary spherocytosis. If spectrin is absent, there will be elliptocytosis. There are two terminologies. Anisocytosis means unequal size of the RBCs and poikilocytosis means different shape of the RBCs. Now coming to the next topic, that is genesis of RBCs. How RBCs are generated. So this whole thing, the formation of RBCs is known as erythropoiesis. So what happens? The stem cells, which are also the hemopoietic stem cells, they forms CFU blast, as we discussed. These will be forming the CFU erythroblast. Now these erythroblasts give rise to proerythroblast. These erythroblasts give rise to proerythroblast, and these proerythroblasts are the first in which hemoglobin appears. And that can be identified by spatial stain known as ENT spin. Another feature of these proerythroblasts, they are rich in erythropoietin receptors. So these are the receptors on the surface of these cells which receive the erythropoietin released from the kidney. Now these proerythroblasts again matures and form the early normoblast. Now these early normoblasts are basophilic in nature. Then the early normoblasts are converted into intermediate normoblasts. These intermediate normoblasts are marking the hemoglobinization. Yes, that means there is presence or appearance of the hemoglobin which will be detected by the routine stain itself. So we can detect it by routine stain also. These cells are known as polychromatic. That's why another name is given like polychromatic erythroblasts. So these are polychromatic because they are containing eosinophil. Why eosinophil? Due to the presence of hemoglobin. So hemoglobin gives them eosinophil, giving them poly means many, chromatin means color. So many colors. Blue because these are basophilic, and red because hemoglobin has appeared in it. Now these intermediate normoblasts forms the late normoblast. Now these normoblasts are having very pinpoint nucleus. Pinpoint nucleus. So we can say pycnotic nucleus. And they are also known as orthochromatic at this stage. So orthochromatic erythroblast is another name to given to them. And after the late normoblast, when this whole nucleus is totally extruded, there will be a cell known as reticulocyte. And this reticulocyte is characterized by complete absence of nucleus, and they can be stained by routine stain, that is the Ramnowski stain. And after 1 to 2 days they fully becomes mature and their size further decreases and they form the normal RBC, that is the erythroblast. So if we talk about the important features, the first appearance of hemoglobin which can be seen by the spatial stain, that is the ENT stain, is seen in the first step proerythroblastic state itself. Then basophilic, that is the early normoblast. Then the intermediate normoblast which has hemoglobinization, which can be seen by routine stain. At this stage, this becomes polychromatic because of the presence of eosinophil as well as basophil. Now, late normoblast, the nucleus will be very small, that is the pycnotic nucleus, and they are known as orthochromatic erythroblast. Then comes the next stage, that is the reticulocytes, when the nucleus, the pycnotic nucleus, is completely dissolved, and there are reticulum like structures which are blue in color, which resembles the free ribosomal RNA. These are known as reticulocytes. After 1 to 2 days, they further become mature, their size further decreases, they will be forming the normal RBCs. Now, during the whole course of the genesis of RBC, when we move to the more mature stage, the size start reducing. So there will be decrease in size as well as the nucleus start dissolving. So dissolution of nucleus is there. Now coming to the next, that is the reticulocytes. So these reticulocytes, as we already discussed, these are the penultimate cells to the erythroblast and erythrocytes, and these are non-nucleated spherical, bigger than RBC, and polychromatic. Why polychromatic? Because they have certain reticular like structures which are blue in color, which resembles the free ribosomal RNA. So these are the reticulocytes. These reticulocytes are important indicator for the erythroblastic activity of the bone marrow. So there is reticulocyte count the normal count being 0.5 to 1.5%, and another thing is reticulocyte index. This index normal count is 1 to 3%. Now this reticulocyte count gives the erythropoietic activity of bone marrow. And this reticulocyte index gives the bone marrow activity and we can call it poor man's bone marrow aspirate. These reticulocytes, as we have discussed, the Ramnowski stain is the routine stain for this, and the special stains are brilliant crescile blue, and the other one is new methyl blue. Now again discussing the blue color. The blue color represents the free ribosomal RNA. The reticulocyte normal count is 0.5 to 1.5%, which gives the erythropoietic activity of bone marrow, while reticulocytic index normal count is 1 to 3%, which gives the bone marrow activity and is known as the poor man's bone marrow aspirate. There are two special stains for this, the brilliant crescile blue and the new methyl blue. Now if we talk about the two phenomena, if there is normal reticulocytes, if these are decreased, they are known as reticulocytopenia, and if these are increased, it is known as reticulocytosis. And when it is increased, it is known as reticulocytosis. Now in this condition, in reticulocytosis, reticulocytic index is more than 3% and reticulocyte count is more than 1.5%. Now when it will be seen? So basically we have to increase the number of reticulocytes, the premature cell just a stage before the erythrocytes. So we want to increase the number of reticulocytes, that is the activity of bone marrow has to increase. How it will happen? When we lose a lot of blood, when we lose a lot of blood, that is hemorrhage, we can have it, yes. Then if there is hemolytic anemia, again we can have it. If there are hemoglobinopathies, when we require more and more RBCs for carrying out the different respiratory functions in sickle cell anemia and in thalassemia, and when there is excess of nutrients. Excess of nutrients mean when there is nutritional supplement anemia, that is folate supplement are increasing, iron supplements are increasing, and vitamin B12 is increasing. So this way we can have a lot of reticulocytes. Now reticulocytopenia, that is the deficiency of reticulocytes. So Ri index will be less than 1% and R count will be less than 0.5%. When it will be formed? When there is aplastic anemia. Bone marrow infiltration. Any insult to the bone marrow will be leading to decreased amount of formation of reticulocytes and all other stages of the cells. So when there is bone marrow infiltration due to any of the cancer or anything, bone marrow suppression due to chemotherapy, radiotherapy, sepsis, all these are responsible for bone marrow suppression. When there is blood transfusion and disorders of RBC maturation, that is iron, folate deficiency, iron deficiency, and vitamin B12 deficiency. So these are the reasons for decreased number of the reticulocytes inside the body. So this is all about the basics of the different kinds of blood cells. Now in the next video we'll be discussing about the classification of anemia. Thanks for watching.